Well, with a measles outbreak involving 9 states, officials from the Allen County Board of Health want to remind everyone vaccinations are key, they say, to preventing the spread of the illness. The Centers for Disease Control and Prevention reports 164 cases nationwide, with the largest outbreak in Texas, where health officials report 146 cases. The Allen County Health Commissioner says if we all work together, we can always help stop outbreaks of dangerous and easily spread diseases before they happen. So you know, the Super Shot Clinic offers the measles, mumps, and rubella vaccine regardless of insurance status. All they ask is payment of $15 for an administration fee. Well, measles is a disease many health professionals actually thought we had kicked, but that outbreak I told you about also includes the death of an unvaccinated child in Texas. Now, Indiana healthcare systems are on alert, and reporter Rachel Wilkerson shares how we can all protect ourselves.
As cases of measles pop up in neighboring states and across the country, health officials are concerned about the possible spread. I spoke to a local doctor about how you can check to see if you're immune.
The average person who has measles will infect 18 other people.
Dr. Shannon Dillon with Riley Children's Health says measles is highly contagious and will stay airborne for 2 hours. So far this year, Kentucky, New Jersey, Texas, and New Mexico have reported cases.
And that's already half as many cases as we saw of measles in the U.S. in all of 2024.
Dr. Dillon says the current vaccine for most kids is the MMR vaccine, measles, mumps, and rubella.
And typically in most kids, we do a dose at age 1 and a dose at age 4.
But there has been a decline in vaccinations across the board, reducing herd immunity. Dr. Dillon strongly recommends vaccinating children and says adults should check their own records. She says you should consider a booster or vaccine against measles if you don't know when or if you've had the shot. You were vaccinated before 1968 because back then the vaccine was less effective. And even if you were vaccinated before 1989, when only 1 dose of the current vaccine was required.
We think that people born before 1957 largely have what we call natural immunity and don't need to worry about getting boosted because measles infection generally provides lifelong immunity after you've had it.
Dr. Dillon says you can even ask your doctor for a blood test to see if you have immunity against measles.